To the extent that there's a positive to take out of this whole pandemic, it's obviously been the heroic work of the medical professionals, the doctors, the nurses, the people that work at the hospital on a day-to-day basis. So today I thought we would focus on one of these stories and head to Houston, where I grew up, to talk with an old elementary school friend of mine, Brent Kasney. He's a doctor there. He works at the Texas Children's Hospital, and along with people on his team and other people at the hospital, they came up with an open source design for a protective system for people who are performing intubations to make sure the virus wasn't spreading in the air. And so with that, let's go talk to Brent and hear his story. Besides being an illustrious alum of Memorial Drive Elementary, do you mind introducing yourself and telling us kind of what you do over there?
Yeah, sure. So I'm the medical director of emergency management at Texas Children's Hospital. And what that really means is that just when there are disaster things that happen, hurricane, flooding, what have you, I kind of help the organization respond to that.
Yeah, but obviously this is quite a different situation.
Whole different ball game. I mean, we are super prepared for hurricanes here. We do annual drills on hurricanes that can, obviously happen annually here. But, I don't think any of us had really started laying the groundwork for a response of like this magnitude. I mean, it's just kind of nuts what we're going through right now across the country and the world.
Some of the early reports were like, it doesn't seem to affect children as much. And I mean, what was your experience like?
I think the good news through this whole thing is that kids don't seem to be as markedly impacted as adults. But we're now seeing these case reports of this inflammatory disease process, inflammatory system response that some kids are having, and there are reports out of New York and the UK about that. And so we're obviously kind of gearing up towards that and making sure we're not going to miss any cases of those or kids that might progress to that.
And so just kind of going back, you started seeing some pictures coming out of intubating people. And I mean, tell me the story. I think you saw these pictures and it kind of concerned you that maybe...
Yeah, I mean, really, one of the things that we were realizing is that, our providers that intubate regularly, so are putting, airways in and things, they're at high risk of exposure, right? There's secretions, you're suctioning, all this stuff. And people were starting to get, really freaked out about their potential for contracting this illness from patients. And so I just kind of been looking on the internet, and somebody sent me something. It was actually a physician in Taiwan had made this just plexiglass rectangular box with kind of two armholes. And I was like, man, that's a really interesting idea, but I don't know that like ergonomically this would make sense for the way that I would put my arms and hands. And I don't know if the access is limiting. And
so you see these pictures, you're like, I don't think this is going to work for me. Let's try something else. And so what, did you just literally start sketching something out on a piece of paper or?
So it started with some paper and some sketches. Then I literally went to our office supply closet and took all the paper reams out of a cardboard box and started hacking it up and taping it together with duct tape. I mean, our facilities team is amazing. And in 5 days, we went from cardboard box to functional working prototype. And so out of this came the Airway Respiratory Containment System, or the ARC, as we call it.
Yes, walk me through just a little bit of the specifics of how it works.
So you essentially put the device over the patient's head, and there's support holes for personnel to get in there. And there's two other holes that I think are really important too. And those holes we use to create negative pressure. So we hook a viral filter up to one of those holes, and then some tubing that you hook up to the wall suction. And so it's essentially sucking, anything that's aerosolized should get sucked out of there, so it's not going to come at you when you take the device off, right? So put it on, I get in there, I put the airway in, hook it up to the ventilator, take the box off, and it's ready for the next patient. We're not trying to make money off of it. There's no IP. Like, it's an open source project that we're just sharing with the world, yeah.
I mean, you guys open sourced it, so like basically that means you just put up like the CAD drawings or the specs and everything behind it, and there's a company called, I think it's called Sawbones, right? That's actually, they're making it.
Yeah, so they tweaked our final design. They kind of made a professional CAD of it, and now they have it on their website. If you want to download the sketch and make it yourself in your wood shop, just like we did, you can, or you can buy one from them, and it's $130.
And this is the device you guys are using in the hospital on kind of a day-to-day basis?
Yes, we've got 4, and they're being used in the operating rooms across the institution now.
And like, I mean, have other hospitals heard about this yet? Have they been able to order some as well?
It's all happening so quickly, and I think there's interest. I think in healthcare, and in particular hospital-based healthcare, we tend to be lagging when it comes to innovation and technology. And my hope is that, like, in the post-COVID era, we'll be able to use things like this as an example and say, like, look, guys, we pushed this through and got it done.